Welcome back to another PT Growth Academy video. Today we are focusing on coaching cues. In a moment, I'm going to show you a lunging clip. Now, the lunging clip is how to optimize any sort of lunge, but we're not necessarily focusing on the technique and the form. Although that is important, what I want you to take away and learn from this video is how we can cue the movement better. Specifically, we can use the reference of a chicken. A chicken is an easy thing that pretty much all patients of yours are going to recognize and understand how they look and how they move. We are going to focus on how they move. When we can get our patients not to move like chickens, we will optimize any sort of lunge, whether you are working on it from a performance or a rehab standpoint. Check it out. So let's talk about how we can raise our standards and elevate how we coach a lunge. This video is not about the technical side, what to focus on to improve the mechanics, but instead, it's how do we improve the way we coach it. Specifically, the words that we use. Why? Because this is something that's not taught in school and something that's overlooked. Unfortunately, telling our patient to lunge down and come back up and repeat sounds great, but the thing is, it's not that easy. There's a lot of things that we need to do and they need to be aware of. So the one key thing I like to tell all patients is to tell them not to move like a chicken. So why do I use a chicken? Well, it's easy to reference because a lot of people know what they look like, but a lot of people know how they move. Ask your patient the next time with them, how does a chicken move? They'll either A, be embarrassed and not show you, or B, they'll show you. And a lot of times you get this forwards and backwards motion. So then we put that into context. Okay, Mr. or Mrs. Jones, as you're going down for the lunge, I want you to stay nice and upright. And as you come up, I don't want you to chicken it. I.e., I don't want you to use your spine for momentum. Why? This is why you usually have back pain when you lunge. This is why you normally have knee pain when you lunge. So if we don't chicken it, as we come up out of the lunge, we actually use the legs to push us up. Now, you'll find that patients have a varying knowledge base of this. First, if they have zero body awareness, then every single lunge is going to look like this. And number two, maybe they have the awareness, but what happens is once they start to compensate and fatigue, that's what they're going to do. They're going to start chickening it. So a lot of times I always like to make sure patients are aware that, hey, you may not do this for the 2 or 3 when we're going over it, but when you're doing 20, when you have load, that's when the chicken comes out. So use the chicken analogy next time you're coaching a lunge, and you should see that it should really optimize not just the performance, but the education and how your patient understands the lunge.